what is visual stress?
What indeed? What is it? But from fMRI studies of the brain, it appears to be that there's areas of the visual cortex that get hyperexcited in response to repetitive patterns, a flicker, or general levels of light brightness. And when we add colour of a very precise level of tinting for an individual, so it's a bespoke colour for that individual, we can reduce that hyperexcitability of the cells in the visual cortex, and we can remove some of the sensory overwhelm, some of the discomfort, and make things clearer and more comfortable for an individual.
Which makes, I think it makes a lot of sense, doesn't it? Because when we're talking about like hyper-excitabilities, which happens in multiple different forms of neurodivergence, you see hyper-excitabilities in terms of giftedness and those who are on the sort of gifted spectrum, but we also see that in autistic people or neurodivergent people who have sensory needs. Again, one of the diagnostic criteria for autism being sensory sensitivities, but evidence suggesting about 60%, maybe more ADHDers also having sensory sensitivities. So visual stress falls into, it's like a small part of a small part, which can have a massive impact in that you have 8 senses. All of those senses can be hyperexcitable or underactive, hypersensitive or hyposensitive. And one of those senses being the visual experience, and visual stress being the discomfort or uncomfortable or impactful experience in that area. Of course, the visual world is incredibly important because the visual world is for many of us, or the majority of us, the world. We have so much visual experience. And what we're seeing at the moment in the working world, but also in the educational system, is the quality of the visual experience getting worse.
Right.
I talked earlier about the quality of lighting being poorer. We're seeing LEDs, which are cheaper, but they flicker, they are often harsher, they're often brighter. You've also got that office plan, open office plan, just continual, all-encompassing bright white light. And then you add in other aspects of visual stress. So if you have discomfort with patterns or discomfort with this overall visual noise, in schools, we've got constant stuff on the walls, we've got pictures on the walls, the phonics on the walls, the letters on the walls, children's words, all different colours. You've got kids moving around constantly. In open plan offices, as we get older, we've got people moving around constantly. They're either beige and just drab, which then brings attention to the bright white light, or you've got high energy, exciting visual noise, which is really hard to control.
Right.
It's really hard to be able to regulate your own visual experience unless you're doing this, wearing sunglasses in the office, putting your hood up, and they're not socially appropriate in the context of society today, that other people would find that unusual.
Yeah.
And so precision tinted lenses give us an opportunity, certainly give me an opportunity as well, to control some of that visual noise without, almost in a socially acceptable way, but also an effective way.
Right.
I think sometimes that's the balance, isn't it? Of there are some things that we know are effective for people, effective to make workplaces inclusive, effective to make education inclusive, but they're not accessible or they're not reasonable.
Yeah.
If every person had their own assistant and every person had their own school assistant, that would be really helpful for everyone.
Right.
It's not fiscally appropriate, it's not financially appropriate, it's not something that we can actually do. Whereas something as simple as putting on a different pair of glasses and the positive impact we can have with that is a really simple and reasonable intervention that we can use. And I think that's what's been really key for me is it's easy to complain. It's easy to people to complain about like how difficult the world is and how uninclusive the world is. And it is. And there is work that needs to be done there. Absolutely. But what I'm always curious about is, so what can we do?
Right.
There's what we can strive for, the end result, which is this inclusive society and everything being great. If we could change all the lights in the world, that'd be great. That would reduce visual stress, but that's not going to happen overnight.
Yep.
So what are interventions we can use right now that are, as you say, accessible, affordable, and usable in the context of how the world works in a pragmatic way. And I think that's what I think is really helpful about tinted lenses, because, as you say, it's as easy as putting on a pair of glasses.
Great. You used an expression I was really interested in. You talk about visual noise.
Visual noise.
What did visual noise mean to you a year ago before you came to see us a Vision Through Colour?
So I think before I came to Vision Through Colour, my context around visual noise was predominantly around differing patterns. So, for instance, if you've got lots of different colours, lots of different things on the wall, lots of different patterns. So you might have, you go to a hotel, for instance, and you've got a very noisy carpet in terms of lots of patterns and colours, and you've got noisy wallpaper and different coloured doors. That's a lot of visual noise and lots of just visual experience for your brain to process and for your eyes to process and your brain to process. So visual noise for me was predominantly around how much you have to process. Once I got working with Vision Through Colour and went through my own process of visual stress, it was also recognizing more about the quality of that noise as well. So not just what's going on, but more specifically, what types of patterns are more noisy than others, what types of colour are worse than others. I hadn't thought as much about flickering. We all know that flickering is uncomfortable if you've got like a single light that's constantly flickering. Everyone finds that annoying. But that more subtle flickering, the imperceptible flickering to the human eye, the flickering when you're driving or walking and there's sunlight through a fence, even if you just live next to a railway station and there's a train going past and that constant flickering of inconsistent light. And so my definition and remit of visual noise got a little more nuanced.
Yeah, that makes sense. And so for somebody like yourself with quite mild visual stress on the scale of the people that we see, do you feel that it helps you attend? Does it help with your attention more generally, or is it just the visual world that's affected?
It's a really interesting question, because obviously I have ADHD as well, so my attention is inconsistent at the best of times. So when I'm assessing any intervention that I use for attention, I also have to factor in my inconsistent attention at the best of times. So it's like, I might stop wearing the glasses, but at the same time I might have a worse time sleeping or a better time sleeping.
Yep.
So it's a really complex ecosystem to work out. But what I can say with a lot of confidence is, for instance, when I was reading, often I would adore reading, and I do adore reading, and there would be times when I would want to read more.
Yes.
And I would have the attentional focus to read more, but I would describe my eyes as letting me down.
Yes.
It's like I'm struggling to continue to read on the page. So then I could sit and put an audiobook on, but the attentional focus was there, but the capacity, the visual capacity wasn't. And then when I started using my other tinted lenses, not these ones because these are prescription, but my reading ones, they allow me to just read for longer.
Yes.
For a bit longer, and I would find myself, I did a train journey to London a few weeks ago. And again, trains are incredibly visually noisy. You've got, as I was saying, that flickering, that noise. You've got people coming up and down. They're quite colourful. The landscape's constantly changing. I had a window seat. But I read, what I would used to do is I'd read for like maybe 15, 20 minutes. And then I wouldn't be able to read for 20 minutes. And I'd have to do something else, put an audiobook on, what have you. And then when I went to London most recently, I found I was reading for 40 to 45 minutes, having a much shorter break, and then returning to reading, and not having that limiting factor be my visual ability to actually read with my eyes. And so it was a really nice almost litmus test of, I'm going to push my limits a little bit. I'm going to try and read for this entire train journey. And I pretty much did. And that's something I definitely couldn't have done historically. So a genuinely simple but important quality of life improvement for me.
So as somebody, and I know that you've read hundreds, perhaps even thousands of books to this point in your life.
Yeah.
If I was now to say, you've got to give those coloured glasses back, you're never allowed to have a coloured pair of glasses ever again, how would you feel about that?
I'd be really sad. Because I would know that I'd have to reevaluate and change my reading habits. I'd have to change how I read, and I would read less. But also, I'd have to be much more discerning about what I'm even reading, because there are some font types, font sizings, page structures that I cannot read. I read one page and I feel really overwhelmed, and my eyes hurt, and I get the shadows and the lines and sometimes color, and I was like, I couldn't read those editions. And some of those editions just look really nice on the shelf, and they're the ones I want to own, and so I want to read those ones because they're nice to read, but they're not nice to read without my glasses on.
So you get 2 chapters in, and that's it.
Oh, not even that.
Guilty.
It's like a couple of pages, and I go, this is the book I'm going to have to audiobook.
Right. Yeah.
Oh, I'm going to have to. I would literally. So I was mild tangent. I was looking for a copy of War and Peace.
You do.
You do. But one that I could read because it's such a big book. It's like 1,100 pages or something. The Penguin Classic and the Vintage Classics. There's all in these small pages, so the text is really close together.
Yep.
Fit it all into one volume.
Yeah.
So I couldn't access that without my glasses, so I'd have to read a 2-volume version. Which again, is that the end of the world? But in that one instance, no. But I don't want to read a 2-volume version. I want to have the opportunity to make decisions where I'm not limited by impairment or experience of disability or difficulties that I have. And so it becomes, by giving them away, and then if I was to give away my glasses, I'm also giving away choice. And I like being able to have choice. And I think that's why it would be sad. I could still live my life, but it would just have a bit less choice and a little bit less opportunity.
So you're glad you found them?
Definitely. Yeah.
Any final words for somebody who's considering an assessment?
For someone who's considering assessment, I went into the assessment thinking I didn't have visual stress and recognized that actually I did, and I just masked it and lived my life in a way that minimized and reduced the amount of visual stress I was experiencing by taking regular breaks, by working strange hours and things like that. So for anyone who's thinking about doing it, is to explore it. Do the visual stress assessment online, have a look at maybe there is something in there for you if you're experiencing headaches, but it could just be migraines, it could be related to something else, but there could also be a visual stress element to that. And I think for me, knowledge is power and knowledge is opportunity, where the more we know about how we personally, individually work, the more that we can be empowered to make decisions on how we want to live our life, what we want to do, as opposed to being forced to do things because the world isn't inclusive.
Yeah.
So, yeah.
Great, that's really helpful. And on the migraine subject, often the best results that we get are for people with visual stress and migraine, because it can make a massive difference to their migraine experience of the world as well. So that can be a massive... Absolutely.
So I'm always sometimes when I'm thinking about when people ask, is it worth it for certain interventions? Sometimes, if getting, say, tinted glasses or tinted lenses reduces the amount of migraines you have by 1 per month, as little impact as that, for some people that's still very much worth it. I think my understanding is it has a much bigger impact than that for some people. Reducing it is much more than 1 per month. But it's how much would you pay? How much effort would you put in to have 1 less migraine at most? What if it was 1 a week? What if it was more than often than that?
Yeah.
And that's really hard to quantitatively put down.
Yeah.
And to have that number, so it becomes, give it a try.
Straight.
Give it a try.
Thanks for chatting.
Thank you very much. And thanks for the glasses. Thanks for the assessment and thanks for the journey, because it has slightly improved my life in a way that I didn't know could have been improved historically. And that's really positive.
That makes me happy.